Hello, Steve White, Steve White's 89. Well, we've got a bit of an update with Madonna's medical problems. Now, I saw a couple of pictures the other day that she posted on various social medias. Um, a frontal one of her in lingerie and a back photo. What are they calling it? It's a selfie of your butt. Whatever. Um, and I noticed those, and I didn't really actually read any headlines or pay attention. I didn't realize right away that she'd actually gone in for treatment till last night. I saw a photo, paparazzi photo of her entering a facility, and I'm like, oh, she's actually finally getting a knee treatment done. Now, she's apparently getting stem cell treatment on the knee to regenerate the cartilage. Now, I kind of find it funny that she keeps referring to a knee injury. Um, because I understand that you can injure the ligaments and that, which then can then cause osteoarthritis in the joint. But I noticed that when she posted the photo, I swear to God, she posted a photo of an X-ray, and people are saying it's of her knee. I'm like, that is clearly a hip. And there's a photo of her hip with um, marks like she has been, I think, injected, because people are saying obviously you take blood, but you also inject it, and it looks like they're injecting into her hip. So I know Mercy made a comment about her hip during the show. She was talking about her knees and knee injury, but and there were some photos where there seemed to be some swelling of the knee, but I think she's getting, if not the hip and the not if not the knee, the hip and the knee treated, and it could just be good old arthritis, osteoarthritis. But she just doesn't want to say that because it sounds old. But that's the reality. She's 61, and a lot of people, nearly 62, and a lot of people who have done a lot of dancing or a lot of physical activity in their career have these sort of problems. Dancers are notoriously bad with suffering from joint problems. So it's not necessarily an age thing in that respect, because obviously had she not been dancing for the last 40 years, she probably wouldn't be having any of these problems yet. So it's more of a practical thing. But I find it kind of curious. I feel like there's a bit of vanity there. I think she's trying to cover up the fact that it's osteoarthritis and not an actual injury, like she fell. But then again, like I said, I have sort of realised I've done a little bit of research into it, because I have my own issues where I had an injury, and that may have done the same thing that she seems to be saying it's done. That because it is possible to injure your knee and the other elements of the knee, and that affects how the knee works, and can impact the cartilage, which becomes osteoarthritis. So it's kind of interesting. I'm now thinking I should be looking into this, because it only costs, at least in America, $3,000 to have a treatment. I thought it was a rich person thing that only someone like Madonna could get done, but it's actually quite attainable for Americans at least. And a lot of people, I probably should, no, I'm not going to bother. They quoted how many people, I was reading some articles, how many people get this done and that. So that's interesting. I do find it funny that that is so a hip, that photo. It cannot be a knee unless it's from a really weird angle. So she's obviously having her hip treated as well as the knee, or she's having the hip treated and saying it's the knee, or both. I don't know. But I found that curious. I'm like, why would you pretend it's just the knee and like, but then show the hip? I kind of found that funny, unless they're taking the cartilage from that. I don't know. I mean, taking the blood from there, I don't know. But I just found it funny. But I'm glad she's getting it done. But I've heard the treatment, although it does seem to be effective and reduces pain, inflammation, problems, and can replace the cartilage, it can take up to 5 years to get, I guess, a really good result. But maybe that's just the end. That's when, like, maybe that's the end game, as opposed to there might be some immediate relief. But it does seem to be more of a long-term solution, which I guess is good, than like a temporary relief. So I don't think she's going to be dancing through any tours in the next year or so. A lot of people seem to think she's just going to pick up and finish off the Madame X show after coronavirus is gone. I'm like, no, they only had 2 shows left. They're not going to go back into the tour just for a couple of shows, unless she wanted to do other legs in other countries, which maybe they were considering doing before the pandemic. So I don't know, but I don't see her returning to performing anytime soon. And a lot of people are saying she's done, she's retired, she's not going to do another tour. This was a failure. I'm not saying this, but other people are saying that it was a failure, and she sort of ended off on a flat note because the Rebel Heart tour was pretty much as successful as any of her other tours. But Madame X, a lot of people are seeing as a failure. But I'm not sure. I'm not sure if she achieved the goal that she wanted of a more intimate show, or if she will try again to do the same sort of show, or if she'll go back to doing um, an arena tour, stadium tour, or if she'll do what a lot of fans have been saying for years she's going to do, which is a greatest hits tour. I'm like, I don't think she's ever going to do a greatest hits tour. I think that would say defeat to her. Like, well, you can't sell your new work. No one cares about your new art, what you're currently doing, which is what matters. So just, retread what you were doing 20, 30 years ago. I don't ever see her doing that. I can see her doing a farewell tour that probably will emphasize on the hits, not specifically a current album, but she would still do new material. It wouldn't be a greatest hits, a strictly greatest hits tour. So I find it interesting that people are still saying she's going to do that. That's not going to happen. But back to the selfies. Madonna's gained some weight. Since she's had this accident, she can't work out as well. She doesn't have that body she used to have, which in reality, she would have looked too thin. If you met her in person, she would have looked too thin. Now, on film photography, she looked good when she was that thin, but she probably would have been too thin in person. She probably looks better and healthier now. But it is kind of funny. I had to make an adjustment to sort of get used to seeing Madonna kind of heavier and not that old sort of Madonna I'm used to, the stick thin, perfectly muscled, perfectly defined sort of Madonna body. That's kind of probably a thing of the past. Between age and the injury, she can't do the amount of cardio and stuff and heavy workouts that she probably. I mean, that's probably why she is where she is, because not only was she dancing for work, she was also working out rigorously every day to keep that body. So, fortunately, I think she's like most women. She tries too hard to be thin and can safely gain a bit of weight and look like a woman. So I think she's fine. She can, and unfortunately, the Kardashians have made big butts the thing, and a lot of people are saying that she's actually had butt implants, which I don't think, but she might have had fat injected into that area, because as you get older, if you're a thin person, muscles, you can keep muscle tight, but skin just sags, and you have two options: remove the skin or fill it with fat. And in places like the butt, you can do that, but that's about it. So you either, when you get older, you either get a saggy butt, or you gain weight and you feel that loose skin with fat, or you can get that done medically. Especially if you're a woman, you can just pump the butt up and sort of get around it, but it does change your body shape. And Madonna never had a big fat butt, and now she has, like, in a good way, a big fat butt. So I guess she had that done, because I'm not sure just traditional natural weight gain could have such a specific effect, like to just affect like one area. Like, she seems to just have a big butt. But I know I shouldn't talk about this because I'm a man, and you can't talk about a woman's body if you're a man. But I'm a gay man and I love her, so, and I'm not saying she looks bad. I'm just saying, I'm just sort of adjusting to this soccer mom body Madonna or whatever, because she does look different, and she doesn't look bad. She just looks different. I'm just not used to it. But I just wanted to mention that because she's obviously not ashamed of it. She's saying, "Here's my butt. There it is." She did a, is it a belfie, like a butt selfie? I can't remember what they're called. But I found that interesting. But I have to say, and I want to say this for a while, Madonna, we know, wears glasses. Now, as you can see, I wear glasses too. I cannot see past about 10 centimetres without my glasses. I mean, yeah, that's about as far as I can see. Madonna, I'm thinking, when she's taking these selfies, she's not wearing her glasses. They're not the best. They're not the most flattering selfies. Usually, it's the angle she does the face at. She does this whole, and she seems to be going for a Stanley Kubrick sort of thing. That's a bit too severe. She needs to just sit back a little bit and not do that harsh angle, because it's not flattering, and it always just gives her this big, giant, shiny forehead in her photos, which doesn't look good on anyone. And then that butt selfie, she didn't sort of crop herself out, because she's sort of taking the picture, but she had her face as well, and her face is like focusing on like the photo. So I think she needs a bit of help with selfies. Also, but she obviously doesn't give a shit, so it doesn't really matter. But a lot of people, criticize it because apparently in this day and age you have to have good selfie etiquette and good, you need to have good selfie skills. And I think sometimes she just doesn't see, because she's not wearing her glasses, that it doesn't look as good as maybe she thinks it does. But ultimately, she doesn't give a fuck anyway. And she's not listening to me, she's never going to, so whatever. But I just want to comment on that because it's been bothering me for a couple of years. I've been noticing, especially that angle. Whatever. But I'm glad she's getting the knee stuff done. Like I said, it's actually inspired me to look into perhaps getting better scans on my knee to find out exactly what's wrong with mine. Is it ligaments? Is it cartilage? What is it? I would like to get back to my body because I used to have a better body because I used to work out, do a lot of aerobics. I was inspired by Madonna, and I always would do a lot of aerobics and a lot of working out, often listening to Madonna music, pretending I was Madonna. And I want to get back to that because I'm still young enough to do that. Madonna, she's 62. Pretty much, she's never going to have the body she used to have. She can get a bit more in shape when she can be a bit more active because of the knee, but there's only so far you can go with that. You can't totally fight age. You can push it back a certain way. So thank you, Madonna, for inspiring me to actually look into the knee things. I didn't realize they could do as much as they can now because no one said anything to me and I didn't look independently into it, but I'm seeing that she can get done. It's not a rich person thing. It's not like something she's getting done as some experimental rich Madonna. I'm, privileged or whatever. It's actually something a lot of people are getting done in lieu of actual surgery. So good luck and thank you, Madonna.